Isn't it time to move beyond the bias that fresh is best when it comes to produce consumption? We know that 12% of American households lack access to healthy diets, and we see disparities across underserved households, specifically in the Black, Hispanic communities. But also, too, we know as a result of this, or related to this, is that less than 1 in 10 Americans actually meet the recommended dietary guidelines of fruits and vegetables. And we see these variations across income levels. Those are the highest income, have the highest intakes, and underserved communities, such as those eligible for SNAP or participating in SNAP, have the lowest intakes. We also know that food insecurity is strongly associated with poor health outcomes, health inequities, and higher healthcare costs. And indeed, we've seen overweight and obesity trends escalating since the 80s. So what we realize, though, or what we hope for in this interesting modeling study done, is that how many servings would we need to change in order to move this needle? And this interesting work by Wang and colleagues found that if we could just increase fruit and vegetable consumption by 0.8 servings per day, we could save hundreds of thousands of lives, billions of dollars in healthcare costs due to improvements in chronic diet-related diseases. So what are the barriers and obstacles to fruit and vegetable intake? We know price is a factor. Prices of fruits and vegetables have been rising compared to all other food and beverage since the 80s. Low incomes indeed lead to low intakes. We also know proximity or accessibility is a factor due to location, like food deserts, or transportation issues. More interestingly, more subtly, but probably equally as powerful, this interesting qualitative work from Dr. Priya Fielding Singh showed that perishability is a factor, right? There's a fear of food wasting and future famine. Pickiness, what if my kids don't want to eat it? Preference, marketing is a huge, huge problem, especially to kids. And so that's a battle parents are facing. What's happening from a policy and a public health perspective? It's often merely implied, but even clearly stated. I mean, here in California, our SNAP program is called Cal Fresh, right? So fresh is stated as the target. But what we're finding is that fresh is perceived as inconvenient. It's cost twice as much. It costs more time and energy. It's less, so therefore less convenient. It also has a planetary impact. When fresh food goes to waste, right, it ends up in the landfill and increases greenhouse gases, which leads to climate change. We've all done that. Bought the leafy greens, put them in the crisper, and found later that they rotted, right? So research on frozen food perceptions and intake is very, very limited. There are no intervention studies that I could find, but the perceptions show that those who are comfortable with eating frozen actually eat more fruits and vegetables in general. And that those who eat some frozen food actually eat, on average, more than 1 cup per day more than those who never eat frozen options. So what are some actions and incentives we can take? We know that nutrition education coupled with financial incentives definitely improves produce consumption, decreases chronic disease, and decreases nutrition and food insecurity. But if we were to emphasize frozen as well as or versus fresh, the benefits of frozen are that it approximates the health benefits, so same from a nutrition perspective. It costs half as much as fresh. It takes far less time to select and prep. And it is much more accessible. We don't have to worry about seasonality or geography. So even our dollar stores in our low-income areas could start to maybe focus on frozen so they don't have to worry about waste, because that is a factor. Perishability and fear of waste exists at the household level, but also at the retail level. And that in turn has its impact on climate. So what about from a policy and education perspective? There are a couple areas in the food as medicine period where we could make a difference. So if we were looking at foundational public health messaging around 5-a-day campaigns or My Plate, we could teach and advocate for the ease, the health benefits, time savings, and convenience and affordability of frozen as a part of those messaging campaigns. In our community programs like SNAP Ed, we could tailor those programs to include frozen and fresh. And in this really cutting edge growing space happening right now around produce prescriptions, we could also include discounts and provisions for frozen as well as fresh. So indeed, the work of Connell and colleagues found that changing attitudes toward frozen fruit and vegetable might be more important than improving access to them. This is something we as integrative medicine practitioners can do. We can change attitudes by changing how we educate, what we emphasize, and empowering our clients, our students, our patients to include frozen as an option in their fruit and vegetable choices. I'd love to talk more. Any questions, comments? You want to see more details on my references for this research, please reach out. Thank you so much for your time.